we have a battle before us, and that battle is to convince people who haven't already got their minds made up completely. We can talk to each other. We're convinced of these ideas, and that the doctor-patient relationship is the most important part of medicine, and that we need freedom of choice in order to achieve that access, affordability, and equality. And then there are people who are absolutely entrenched that the only way to solve that problem is through government. Speaking to those people in the next 30-some days is a waste of your breath. We need to find ways to message to people who are open to our ideas. And I think some of the problems that we've had with trying to get our message across is that we've talked about efficiency, we've talked about saving money, we've talked about some constitutional issues which, although are very, very important to us, they do get put secondary to the fact that there are stories of people who are suffering, people who need medical care who don't have access to it, and that this is what our very compassionate fellow citizens want to have the problem solved. So we need to be able to offer to them visible, real, concrete examples of how we're going to solve this problem without government. So my idea of doing it is we're going to achieve this through abundance. Part of the problem is that the people who are in favor of Obamacare, and we're allowed to call it now Obamacare, without seeming snarky or irreverent, it's because they've made the case that Obama cares, and if you're not for Obamacare, it's because you don't care. That argument has been very successfully made by the proponents of Obamacare. They've presented our country with a false dichotomy, that either we have government health care or we're going to let people die in the streets. That's the choice that they think that they've made it. They have, the proponents of government-funded, government-controlled health care have co-opted the use of words that are very important and that we need to take back. Things like access, I want access, affordability, which means that things are actually affordable not just because you're getting money from the government, but because they actually cost less, right? Quality, what does quality mean? Fairness. Dr. Brooke talked about fairness, and they've co-opted the meaning of that word. Compassion. Things like evidence-based. How can you come out against what the government is proposing about evidence-based guidelines without sounding like you're against evidence? But nobody's against evidence, but unless we can really reclaim these words, that's what it's going to come across as. And the other aspect of how to speak about these issues, and this is part of what I want to do with Benjamin Rush Society, is get into the medical schools, change the conversation, change the moral narrative of how these issues are being discussed so that it's obvious that we're the ones that are on the moral high road here. But also, if all you do is critique and go through the laws and explain how horrible it's going to be, it demotivates. And Dr. Ben-Bissett talked about that's really a big part of the battle that we're up against with our colleagues. That steamroller is coming at them, and they're ducking and hiding, and who can blame them if all we offer is critiques about how bad it's going to be? We need to be able to inspire them with alternatives of what we really can do, the positive-based things. So when people tell me, if you don't have Obamacare, that means you're going to let people die in the streets, I reply, if with government medicine, that does not mean that people will not die. People will die with Obamacare. And people will die with Obamacare because of limited resources. People die in a free market because of limited resources. Because limited resources require limits. Right? Okay? But with a government-run healthcare system, you're going to get, how do they treat those limits? They start with a fixed pie because the government doesn't create wealth, it just distributes it. You're going to have to deal on cost containment, cutting services, top-down central planning, and the most important thing, mandated value choices. So the limits, those decisions on how those limits are going to be used, they're made not by individual patients and doctors and what works in the best individual situation given their life history, their values, their personal resources. It's made by a bunch of bureaucratic so-and supposedly experts. And contrast that, however, with what happens when you allow the market to do it. You get greater productivity, you have lower prices through innovation, and it's personal value choices. So people will die because there's limited resources. The main difference between, not the only difference, but the main difference between government medicine and the free market is who gets to make those value choices. And in our case, I mean, and this is for every aspect of the market, right? But in our case, it's life and death choices. It's quality of life choices. And people are handing those over to the government. It is true, government medicine creates winners, and they'll point to 26-year-old children. They'll point to children with pre-existing conditions. They'll point to the fact that women now will pay the same as men, that if you're older and sicker, you don't have to pay as much as you used to. So it does create winners. It's not going to work if you deny the fact that Obamacare creates winners. What they're totally not telling people, and what we need to be able to tell people, is all the losers that it's creating, because there's many, many, many more losers. And the biggest winners are big insurance, big farm, big hospitals. People don't understand that. But let's get into some of these language changes. Fairness. As Dr. Brooke explained, fairness has been co-opted. It no longer means equality before the law, playing by the same rules. This is what justice used to stand for. And John Rawls co-opted that into what's called social justice, which is basically injustice because it's trying to make everybody equal. I don't need to go through that again. He did. But what are some examples of this that we could go back to what is truly fair? What are some positive things for us to reclaim fairness? Equal tax law for everybody for health care. No matter how you pay for your health care, it needs to be treated equally in the tax system. That's the source of the pre-existing condition problem. If it wasn't for the fact that there's a huge tax benefit to get it through your employer, you would own your own health insurance the way you own your own life insurance, homeowners insurance, all that. So we need equal tax for all health care. We need to limit regulatory power because, by definition, regulations is arbitrary. It's not equality before the law. They have to make regulations because they can't do the law at the level of detail. They have to just delegate those decisions, and it's customized. But customized law is not equality before the law. And physicians-owned hospitals, they're another one that's a big loser here. They're not being equally treated before the law with the large hospitals. Government's position and purpose is not to pick the winners and losers. Compassion is another place where we really need to be able to reclaim this. So what is compassion? The people who support government medicine say it means we want everybody to be able to get access. Well, what I want is meaningful access, not meaningless coverage, which is what the ACA does. It's meaningless coverage. Okay? The other thing is that coercion, there's no way that coercion is compassionate. As soon as you have coercion in there, it's no longer compassionate. What about community? That's one of the things that I'm accused of when I speak out in my own community. You're just not for community. That's why you don't want to pay taxes for education and taxes, higher taxes, and have the government take care of it. You're just not a community. You're not a team player here. Well, I'll tell you what my definition of community is, and it's voluntary interactions. It's not coercion. Freedom of choice, and by that I mean freedom of contract, being able to set your own prices, prices in your health, design your own health insurance the way you want to, not being told by the law that it's illegal for you to have a certain kind of health insurance. I mean, Dr. Brooke talked about the problems with unemployment because of minimum wage. We have minimum insurance laws. So if if minimum wage cause unemployment, what do minimum insurance laws cause? Uninsurance, right? Okay, so we need those to be able to have freedom of contract. And a big part, too, of our tort system is there's not really true contract liability present. That's only part of it. So cooperation, charity, all those things, that's what I think of as community. So they talked about win-win, not coercion. That's not what we're talking about when we talk about capitalism. So what about access? This is another term. They think that they're for access and we're for die in the streets. No, we're for making medical care accessible because it's affordable. And you can't do that through redistribution. You have to do it by growing the pie. You have to do it through an abundance. How do you get an abundance? The same way the rest of the market has done it. And you do it by allowing innovation. You unleash the incredible creativity of not just medical entrepreneurs, but delivery system entrepreneurs, all of those. Health insurance entrepreneurs, they need to be liberated. The other part of access is we need safety nets that empower. And I think a key to this is the defined contributions. We've seen a movement to defined contributions from pension system to 401k, and nobody's talking about voucher retirements, right? So the denigrative word now for defined contributions is voucher care. But people like their 401ks. They like the control that it gives them. And they're still getting a contribution from their employer. And now Sears, I don't know if you saw, like just 2 days ago, Sears is now going to define contribution for the health benefits. Now, is that going to be legal under Obamacare? I don't know. Probably not, just like they're going to outlaw catastrophic care. Insurance. Food stamps. There's no shortage of, people aren't being turned away from grocery stores the way they're being turned away from physicians for Medicaid. So there is a way even to have some safety nets that don't decrease our access, but you really give meaningful access. Medicare with the expanded choice and control with the defined contribution as opposed to this bottomless black hole pit that Medicare is. Defined contributions is a step in the right direction to giving patients control over their own money, their own value decisions about how their health care is going to be treated. And with Medicaid, a place to start is block grants. Are these the absolute final word? No, but I don't think our country is psychologically ready to go complete free market. They don't trust it. It's been decades. They can't even imagine what a real free market would look like. They think it's chaos. They think it's anarchy. But so that's why we have to take these first steps. So what I want is progress and affordability with a free market. We've done it with this, right? We've done it with computers. That's the first banking computer up there on top. And there's actually more power in a laptop now, in your laptops, than there was in the entire NASA when we put the person on the moon. Astounding. People want health security. I understand this. We want to give it to them. And we want to give it to them by creating plentiful, affordable, reliable medical care. And how are we going to do that? Unleash the creativity of the medical entrepreneurs. We're not going to do it through control, regulation, and uniformity, because you know what you get with that? Medicine at the speed of government. So you want medicine at the speed of the entrepreneur and the innovator, or do you want it at the speed of government? Because you tell me which is going to save more lives, which is more compassionate, which is a better sense of fairness, which is going to give you quality. So we have to retake those terms completely. We are on the verge of an age of accelerating medical excellence. That's a retina, right? Clap, we are, you are. Okay, that retina, sitting on that retina is a computer chip. Do you guys know what this does? Yeah. It lets the blind see. This is available. This technology exists. External robotics. I hope this is not a surprise to you. It is when I give this talk to lay people. There are external robotics that allow paraplegics to walk. Here's another robotic. An amputee has a robot attached to their nervous system. This functions on this man's own thinking, his own brain. This exists. Here's a little glucometer. See the bottom? It says 102 on the bottom of there. So a diabetic can stick a drop of blood in a little slot there. It reads his blood sugar and sends you, the physician, what his glucose is at the moment, if you need to know. Or him, if he's keeping his own records, if he's capable of doing that. When I went to medical school, most of you guys, same thing, but for you guys in the back, pacemakers looked like you had a cell phone on your chest, underneath the skin, right? Huge. That's a penny, and that's the new pacemakers. Incredible stuff. Can you think of what we can do for the third world if we continue to bring down the cost of these handheld ultrasound machines? To take those diagnostics to a place where there's no hospital, half the time there's not even clean running water. Incredible. And this is what we're going to cut off. This is what we're going to cost control. This is what we're going to stop because we're spending too much money already on healthcare. And then when I give talks to seniors, this is their favorite. This is a camera that you swallow. No more colonoscopies. Unfortunately, you still need the prep. So this is part of a TED Talk by a physician, Daniel Kraft. I really extol you to go Google that and watch the rest of it because we really, really are. This is the kind of thing that people need to know about this. Now, is it expensive to have that computer chip in the back of your eye? You bet. Is it exorbitantly expensive for those robotics? Yes, just like the original cell phone cost $3,000 and was the size of a brick. How are we going to get those available to everybody who needs them? It's not going to be redistribution. And just as we're getting innovation in the area of medical treatments, medical devices, we can also have innovation in the way that healthcare is delivered. And you guys already know all about cash practices. So my good friends in Florida have Epiphany Health, and for $89 a month, they offer 26 family doc visits, all the preventive health care that is required by the new law. They've been able to go out and contract with smaller labs and diagnostics and x-ray places. They can get chest x-rays for $20 for their patients. Labs for $5, and nobody twisted an arm, nobody's putting a gun to their head. What they did was they said, if I guarantee that all you have to do is once a month send me a bill for my patients and I promise to pay you within 3 days and you don't have to do anything else, what's the cheapest that you're willing to charge me for your service? And those are the kind of prices that they're getting. $200 or $300 mammograms. I mean, you know, it's just MRIs. I don't know all the stuff that they're getting. Now you need to be able to and the other thing is, right now they still have insurance practice, they still take Medicare, they're trying to transition more and more of their patients to this. There's probably about a quarter of their patients to this because they're making more money on this. And they are actively seeking out the uninsured, people who can't otherwise afford this. And they're starting to look into contracting with businesses, but they're having to also kind of dance around some of these. Are they in insurance? Are they not? You guys know the whole thing, but it's a subscription practice. Again, without being able to pair this with catastrophic health insurance, this model will get killed. This model we've been able to take as up to the Hill in Washington, and we've actually opened the doors of some Democrats, and they're starting to listen to us. Ron Bachman is a gentleman who's in Georgia, and he's coming up with a private alternative to healthcare exchanges. He calls them health insurance marketplaces. That exists. The private practice doctors is a cardiologist in LA, I think, that is just trying to get purchasing power by getting doctors together so that you can join and have your billing and your own insurance for your employees and so forth done with that. So there's all sorts of creative things that we can do to bring down costs, bring up quality. Part of the whole message has to be tapping into what Americans believe in, and that is that we are independent. We are proud of having our ownership society so that patients eat healthfully, they exercise, they go to their doctor on a regular basis. For high costs, they get health insurance. For small or medium costs, they save. And in those rare cases where they have exceeded their personal funds and their resources, there are a myriad of nonprofit volunteer organizations that will step in and help them with their care. But what we as a society will not allow is reaching into our neighbor's pocket to pay for our own health care. That's what we have to say is wrong. Whether you do it directly, indirectly, with a gun or with a ballot box, it's wrong. And we can talk about efficiency all we want, but once they take your money, who cares how well they spend it, right? These are the kind of messages that I want medical students to get. I want them to be able to defend, and I want you to be able to go out there, proudly defend that private practice of medicine. Free medicine, free market medicine is a moral activity. I want to reclaim all those words that really stimulate and activate people who honestly care about those who are suffering. And we're part of that, and we need to make that clear. We don't agree that the other solutions are going to work. So we want to educate doctors in training. Here's part of what we're up against. These are, if you'll notice, there's September 2012, and August 2012. These are surveys of all of them, about 1,000 medical students. 80% pretty consistently support the ACA, except for the one where we've got 48% support it, but that's because 40% don't even understand it. And even of those that support it, most of them don't even, a majority of those that support it don't even think that it's going to improve the quality of care. People don't care about quality. They want that equality. We have to get away from that. And how do we do this in the Benjamin Rush? We create events where there's discussions, there's lecturers, some famous, some local. We want to be able to show people what's going on, give them real alternatives, concrete examples of how people are making this work, how you can preserve that doctor-patient relationship. This is a culture change that we're up against. So no matter what happens in the election, we still have our battle cut out for us. We're going to start shifting this, but it's a long-term battle, and we need to keep fighting it. Back in the 1700s, late 1700s, 1776, America led the world in the battle of ideas for economic freedom and for political freedom. And we did so unapologetically, right? Absolutely. Enough of this, the rest of the industrialized world has socialized medicine. We now need to unapologetically lead the world in healthcare freedom. Absolutely. And we need to bring the young guys along with us. If you're interested in helping mentor some of the chapters in Benjamin Rush, last year we had 11. We've had 20 over the period of time, but we get some attrition as they move into their clinical years. I want some continuity for the clubs. I want some resources for the clubs. I've got sign-up sheets. Come get my card. Fill out a sign-up sheet. I want mentors. They're future AAPS members. So I think we can work together really well. Thank you.